Hi, I'm Dr. Chris Gubbels from Scoliosis Denver, and in this video, I'm going to answer your questions about scoliosis treatments and insurance coverage. You see, scoliosis is a really complex condition that can impact people of all ages, but navigating the insurance landscape for treatment can be equally as challenging. So if you or your child have been diagnosed with scoliosis, understanding your insurance coverage is a critical first step in receiving the care you need. So let's review coverage for different diagnostic testing. Now, insurance typically covers diagnostic tests for scoliosis, including MRIs, X-rays, and physical exams. These tests are essential to confirm the diagnosis and to determine the severity of the curve. Now, to ensure coverage, these tests must be deemed medical necessary by your provider. Some tests, such as an MRI, may require a pre-authorization to be covered by your insurance. Here's a pro tip. Always request a pre-authorization for advanced diagnostic imaging to avoid any unexpected expenses, such as those from an MRI. Now at Scoliosis Denver, our team assists patients to really help ensure that all the necessary approvals are streamlined and to make this a really easy process. Now, what scoliosis treatments are covered by insurance? Insurance plans often cover a range of scoliosis treatments. To the extent of coverage though, that can vary from one insurance company to the other. Commonly covered treatments include physical therapy. Many plans cover scoliosis specific exercise like those that we offer with ScolioBalance at Scolicare. Now, scoliosis specific exercises are billed to insurance using therapy codes. The codes you want to check for are 97110, which is therapeutic exercise, 97530, which is therapeutic activity, 97112, which is neuromuscular re-education, and 97012, which is mechanical traction. Those are the most commonly billed codes for scoliosis-specific physical therapy. Now, what about bracing? Custom scoliosis brace like the Scoli brace are typically covered by most insurance companies. Now, they may require pre-authorization and a letter of medical necessity from your provider. Now, to ensure your plans, you want to make sure that your insurance plan covers durable medical equipment or DME. Now, different types of scoliosis braces require different codes for billing. The most frequently used codes for billing a rigid brace like the Scoli brace is L0482 and L1200 or L1200. These are TLSO braces or thoracic lumbar sacral orthosis. The codes for soft braces such as the spine core are L1005, and codes for the off-the-shelf scoliosis brace such as the Aspen Peak scoliosis brace is L1300. Now, what about surgical interventions? In severe cases, spinal fusion surgery is typically covered but requires thorough documentation and necessity. And some insurances even require that conservative methods have already failed before they will consider paying for surgery. Now, if you're liking this content, be sure to give us that thumbs up and make sure you hit that subscribe button down below so you can be notified when we release new content on scoliosis treatments. Now, what do you need to know about prior authorizations or pre-authorizations? You see, pre-authorizations is a common requirement for scoliosis treatment. Now, this process involves obtaining an approval from your insurance provider before starting the treatment. Failing to secure pre-authorizations may result in a denial of coverage. Now, in our experience, things like exams, X-rays, and physical therapy do not typically require pre-authorization. However, scoliosis braces may. Another pro tip. Pre-authorizations may be required for braces that cost more than $1,000. Now, your insurance company may say that a brace does not require pre-authorization, but you want to clarify if authorization is required for a brace that costs above a certain amount. So how does one go about navigating pre-authorizations? What you want to do is you want to consult with your healthcare provider to understand the documentation that's required. You want to submit a detailed treatment plan to your insurer, and then you want to follow up regularly to ensure a timely approval. Don't just wait for them to respond. If you're not hearing anything back, you want to check on that prior authorization. Now at Scoliosis Denver, we provide letters of medical necessity and all the paperwork that's required for a pre-authorization and for insurance reimbursement. Now, what's the difference between an in-network provider and an out-of-network provider? Receiving treatment from an in-network provider can significantly reduce the costs that you had to pay out of pocket. However, most scoliosis specialists, excluding some surgeons or a lot of surgeons, do not really contract or typically contract with insurance companies because of the low reimbursement rates. You see, insurance companies have agreements with in-network providers offering discounted rates for services. And because insurance contracts can severely reduce the reimbursement, many specialty clinics cannot really afford to contract with insurance companies. Some insurance companies, such as Blue Cross Blue Shield and Anthem, haven't even increased their reimbursement amounts since the year 2000, over 25 years, which is why so many providers are deciding to go out of network. So always confirm your provider's network status and ask for both in-network and out-of-network coverage and reimbursement rates when you're checking with your insurance company. So what if your provider is out of network? You see, out-of-network care may lead to higher out-of-pocket costs, but many PPO plans typically still offer reimbursement rates. An HMO plan will typically only cover insurance, though, with providers that are actually contracted with your insurance plan. So check your policy details and consider discussing payment plans with provider if the out-of-pocket costs are higher. Now, it's also really important to understand coverage limits and any possible exclusions. You see, insurance policies often include coverage limits or exclusions for certain scoliosis treatments. For example, some plans may cap the number of physical therapy sessions or visits that are covered annually. They may deem treatments as experimental and may be excluded. This is a tactic that we're seeing more and more with insurance companies, where they're clumping tons of treatments that are backed by scientific evidence as experimental to reduce what they actually have to pay. Now, most insurances also have set rates that they will allow or pay for reimbursement. So be sure to check with your insurance coverage if you have allowable amounts, a certain number of treatments you can receive in a year, and then how much they will allow for each individual treatment. Just because the provider, let's say for example, bills $100 for a certain service, does not mean your insurance will actually allow $100. They may allow $50 or $70. And that's all your insurance actually gives you credit for reimbursement or to contribute towards your deductible. Generally though, the out-of-network providers get higher allowables than in-network. They actually will pay for more per visit than they will in an in-network, because out-of-network doctors are not restricted to the severe or low reimbursement with in-network contracts. Now, understanding these limitations is really key to avoiding any unexpected expenses. So contact your insurer, clarify any ambiguous policy language, and make sure they fully understand your coverage. Now, the type of provider you are going to can also influence reimbursement rates. Insurance plans require treatment to be covered by a licensed professional, such as an orthopedic surgeon, a chiropractor, physical therapist, certified orthotist, or medical doctor. Additionally, some insurance companies actually pay different rates depending on the type of provider you're going to. So choosing a provider with specialized training in scoliosis, like those at Scoliosis Denver, ensures both quality care and compliance with insurance requirements. Now, what about the appeals process? If your insurance claim is denied, don't lose hope. There's an appeals process which actually allows you to challenge the decision and provide additional evidence or information to support the medical necessity of your treatments to help you get paid. So let's go over the steps to appeal a denial from your insurance company. What you want to do is request a detailed explanation for the denial. Why did your insurance not pay for the treatment? Then you're going to gather all the supporting documentation, such as your medical records and provider recommendations. Make sure you have the diagnosis and the exact CPT codes. Then you're going to submit a formal appeal within the specific time frame. If a claim is denied, you will have a certain time frame, typically 60 to 90 days, to actually appeal that denial. So make sure you respond and submit an appeal within a timely manner. Now, our team at Scoliosis Denver can guide you through the whole process to help improve your chances of a successful appeal if you do get a claim denied. Now, what about Medicaid and Medicare? Medicaid and Medicare may cover surgeries for scoliosis, they may cover physical therapy, and they may cover some bracing. However, outside of surgeons, most specialists do not contract with Medicaid or Medicare due to really low reimbursement plans by government health insurances. So even though you may have treatments that are covered by that, finding a specialist that is actually contracted with Medicaid or Medicare can be challenging. Now, if you have more than one insurance plan, you need to understand the coordination of benefits. So if you have multiple insurance policies, coordination of benefits determines which insurance pays first. For example, if you have a child and both parents have a different insurance policy, you have to know which is the primary insurance and which is the secondary insurance, because failing to build a primary insurance plan first will typically result in a denial. So make sure you understand which insurance plan should be billed first. It's also to understand how insurance reimbursement may vary depending on the patient's age. Now for pediatric scoliosis treatments, for children and adolescents, including bracing and physical therapy, these are typically covered by most insurances and deemed medical necessity. When someone's transitioning though from adolescence to adulthood, that can sometimes disrupt coverage. So if you get someone that's in like their early 20s, you need to verify if they're still covered under their parents' insurance plan, or do they have their own insurance, because you don't want to just assume they're still covered under those plans. Now, coverage for degenerative scoliosis in adults often focuses on pain management, physical therapy, and bracing. Surgery may be covered in severe cases, but typically only when non-surgical methods have failed and you've exhausted all your options for conservative treatment. Now, if you found this information helpful, be sure to hit that subscribe button so we can notify you when we release new information on scoliosis and hyperkyphosis treatments. And if you or a member of your family are suffering from scoliosis and you're trying to figure out what your best treatment options are, click on the discovery call link below. Set up a free discovery call. This gives you a chance to discuss your case with myself. Our office will reach out to you and they'll set up a time where we can get on the phone. And ideally, if you send me your x-rays beforehand, I can review those to give you the best possible advice. I hope you found this information helpful, and if you have any questions, put those in the comments below.